Sometimes the cruelest things in the world are not done with fists or weapons. They are done with words. They are done with a smile. They are done by someone who has everything, looking down at someone who has almost nothing and laughing. This is a story about one of those moments, and about what happened when a judge decided that enough was enough. If this kind of story moves you, if you believe that no human being should ever be mocked for being sick and poor, then subscribe to this channel right now. Hit that bell, because we tell stories like this every single week and you do not want to miss a single one. Subscribe now before this story goes any further. Let me tell you about Marcus Allen Webb. Marcus was 53 years old. He worked as a maintenance technician at a public school district in Tulsa, Oklahoma. He had worked there for 18 years. He drove a 2006 Chevy pickup with 200,000 miles on it and a cracked windshield he kept meaning to fix. He wore the same 3 pairs of work boots in rotation and polished them every Sunday night because his late mother taught him that taking care of what you have shows respect for the life you are living. Marcus had type 1 diabetes, diagnosed at age 9. His co-workers called him the most disciplined person they had ever met. His daughter called him the strongest man she knew. Marcus Allen Webb was not a man who asked for sympathy, he just wanted to live. Now let me tell you about Derek Thorne Calloway. Derek was 31 years old. He was a pharmaceutical sales representative for Vita Pharma Solutions, headquartered in Dallas, Texas. He drove a black Porsche Cayenne with tinted windows. He wore a Rolex Submariner on his left wrist, the kind that costs more than most people earn in 6 months. His LinkedIn profile described him as a top-tier healthcare solutions professional. His colleagues said he was charming when he needed something and cold as ice the rest of the time. He had grown up wealthy, attended a private university on a legacy admission, and landed his pharmaceutical job through a family connection. Derek Calloway had never once worried about paying for medicine, not one single day in his life. On October 7th, a Tuesday morning, Marcus arrived at the Tulsa County Medicaid Enrollment Assistance Office on South Denver Avenue at 9:45. He had taken 2 hours off work without pay to be there. He was trying to navigate an emergency assistance program to help cover the gap between his insurance and the actual cost of his insulin. Around 10:15, a pharmaceutical representative arrived at the front desk. That representative was Derek Calloway. He was there to drop off promotional materials. He glanced around the waiting room with an expression that one witness later described as barely contained irritation. At 10:20, Marcus was called to a service window. The woman behind the desk confirmed that due to a processing error, his emergency insulin coverage had been delayed by another 3 weeks. Marcus quietly explained that he had already been rationing his insulin for 2 weeks. His voice was calm. He told her he was not sure he could safely stretch it another 21 days. She said her hands were tied. It was at that moment that Derek Calloway, standing just a few feet away, looked over. He had clearly been listening. And then he said it, loud enough for the entire waiting room to hear. He said, "Maybe if people planned better financially, they wouldn't need to ration medicine they need to stay alive. That's just called budgeting." The waiting room went silent. Marcus turned and looked at him. A woman with a young child in her lap stared at Derek like she could not believe what she had just heard. Marcus said quietly, "I have worked for 18 years. I have paid into this system my whole life." And Derek Calloway smiled and said, "Not my problem, man. Take it up with your accountant." Marcus did not say another word. He picked up his paperwork. He walked out to his old Chevy in the parking lot, and he sat behind the wheel for a long time before he drove away. But not everyone stayed quiet. Before you hear what happened next, I want to say something to everyone watching. We have built something real here. Hundreds of thousands of you have found this channel because you believe everyday people deserve to be seen and heard. You believe stories about justice and dignity are worth your time. If you are new here, subscribe right now and join a community that genuinely cares. If you have been here before, thank you. Let us keep going. A woman named Sandra Okafor Hughes had been sitting in that waiting room. She was there applying for her son's supplemental benefits. Sandra was a former paralegal who now worked part-time at a nonprofit. She had her phone in her hand when Derek made his comments. She had started recording just before he spoke. She captured his voice clearly. She captured the silence that followed. She captured Marcus's quiet, dignified response, and she captured Derek's dismissal. Sandra did not post the video immediately. She thought about it for 2 days. Then she called the Oklahoma Medical Licensing and Ethics Board, the State Attorney General's Consumer Protection Office, and a journalist at the Tulsa World who had written about insulin affordability. Within 48 hours of publication, the video had been viewed over 1.2 million times. The story that came out was bigger than one moment in a waiting room. Investigative journalists pulled Derek Calloway's professional history. A former co-worker said Derek had once bragged in a sales meeting about selling insulin at a price point he described as, and these are his words, aspirational for low-income markets. Another colleague said Derek had made similar dismissive remarks about patients who complained about drug costs. The Vita Pharma Solutions Ethics Hotline had received 2 previous complaints about Derek. Both had been quietly closed. Neither had resulted in any action. A review of Derek's sales records, obtained through a subpoena, showed he had been involved in a price-flagging scheme where certain medications, including specific insulin formulations, were being marked up in targeted zip codes with high Medicaid enrollment. When combined with internal communication showing awareness of patient harm, the Tulsa County District Attorney's Office built a case around consumer fraud, targeted healthcare exploitation, and violations of state patient dignity statutes strengthened just 2 years earlier. Marcus Allen Webb was asked if he wanted to participate. He said yes. He said he did not want the next person sitting in that plastic chair to go through what he went through. I want to pause here for just a moment, because I have been telling stories about justice for a long time, and I will be honest with you, I do not always believe the system gets it right, but I keep telling these stories because I believe that enough light, aimed at the right place, can change things. If you believe that too, I am asking you to take action right now. Subscribe to this channel, click the bell, leave a comment below that says justice matters so I know you were here today. Because this community is what keeps stories like Marcus's alive. The hearing was scheduled for March 4th in Courtroom 7 of the Tulsa County Civil and Criminal Courts Center. Every seat in the gallery was taken. People were standing in the back. Local news cameras had been granted access to the hallway. Derek Calloway arrived at 9:58 a.m. wearing a navy blue suit with a pocket square folded in 3 crisp points. His attorney, Roland Fitch, walked beside him. Derek's chin was slightly raised. He looked like a man who was inconvenienced, not a man who was afraid. He glanced once at the gallery and then looked straight ahead, as if the people watching him were beneath his attention. Marcus Allen Webb walked in 2 minutes later. He was wearing his church clothes, dark slacks, a white button-down shirt that had been ironed very carefully, brown shoes that were old but clean. He carried nothing. He sat in the front row with his daughter Priya, 24 years old, beside him. Priya held his hand. Marcus sat with his back straight and his hands folded in his lap. He looked at the front of the room and waited. The power imbalance was visible from across the room. One man arriving like power, one man arriving like dignity. They were not the same thing, but that morning the courtroom was about to decide which one mattered more. The presiding judge was the Honorable Carolyn Ray Simmons, 61 years old, 19 years on the bench. Known for absolute command of her courtroom. She entered at 10:03 a.m., settled behind the bench, looked out at the room for a long moment and said, "Let us begin." The prosecution presented 3 major pieces of evidence. First, Sandra's video recording, played in full with audio. When Derek's words rang out in that courtroom, several people in the gallery shifted in their seats. A woman near the back pressed her lips together so hard they turned white. Second, the internal communications from Vita Pharma Solutions showing the targeted pricing strategy. One email sent by Derek to a regional manager read, "These markets have soft resistance. They complain, but they keep paying. Maintain the bracket." A man sitting 3 rows behind Marcus covered his mouth with his hand. Third, Marcus's own medical records, presented with his consent, 18 years of perfect management. and a 2-week rationing period that had caused a dangerous blood sugar episode Marcus never reported because, in his own words, he did not want to be a burden on anyone. Sandra Okafor Hughes took the stand. She was calm and precise. She said, "I have never heard anything like what I heard that morning. It was not careless, it was deliberate. He looked at that man and he chose to say what he said." Marcus's physician, Dr. Anita Raghunathan, testified that the rationing period could have resulted in diabetic ketoacidosis. She said clearly, looking at the jury, he was in real danger, he just needed help. Then Marcus himself took the stand. He was asked how he felt in that waiting room. He was quiet for a moment. Then he said, "I have managed this disease my whole life. I have never asked for pity. But I needed help that day, and instead of help I was mocked in front of strangers for being sick. I am 53 years old. I have never been ashamed of who I am. But that day for a few minutes I felt small. And that is not okay. Nobody should feel that way for being poor and sick." The courtroom was completely still. Before we get to the verdict, I want to acknowledge something. You are sitting wherever you are right now, and you chose to spend your time on a story about a man most people never heard of. That means something. You are the reason this channel exists. Every subscriber sends a message that stories about ordinary people matter. If this has ever made you feel like justice is real and worth fighting for, subscribe now to show your support. Thank you for being here. Truly. Derek Calloway took the stand in his own defense. He was controlled. He said the comment had been taken out of context. He said he had not intended to be cruel. He said he was under stress that day. His attorney argued the pricing emails were standard industry practice and that the connection between the video and the broader pricing conduct was legally tenuous. But then the prosecutor asked Derek one simple question. She asked if he believed at any point before this hearing that what he said to Marcus Webb had been wrong. Derek paused. Then he said, "I believe my comments were imprecise, but I am a businessman. I do not set healthcare policy. My job is to move product." The room absorbed that. The prosecutor said nothing. She let it sit. She turned and walked back to her table and said, "No further questions." Judge Simmons looked at Derek Calloway for a long moment. Then she said, "Mr. Calloway, I have sat in this courtroom for 19 years. I have heard a great many things. But the phrase move product, used to describe medication that keeps human beings alive, is something I will not easily forget. Now I need to tell you something personal. My Uncle Gerald was diagnosed with type 2 diabetes when I was 12 years old. He was a proud man who never complained. But I remember visiting him in my early 20s and seeing that his insulin was gone, not low, gone. He had skipped doses for 3 weeks to cover rent. He did not tell anyone. He did not ask for help. He quietly put himself in danger because he could not afford not to. Gerald died at 67 from complications his doctor said were made significantly worse by years of inconsistent medication access. He was not a statistic to me. He was the man who taught me how to tie a fishing lure and how to tell when someone needs help, even when they say they are fine. When I read about Marcus Webb, I thought about Gerald, and I knew I had to tell this story. The jury deliberated for 4 hours and 22 minutes. When they returned, the foreperson stood and read the verdict clearly. Guilty on the consumer fraud charge, guilty on the targeted healthcare exploitation charge, guilty on the violation of patient dignity statutes. Derek Calloway's expression did not change, not right away, but his attorney's pen dropped from his hand and hit the floor, and for just a second the sound of it was the loudest thing in the room. Marcus Webb closed his eyes. Priya put her arm around him. A woman in the third row said quietly but audibly, "Thank God." And then Judge Simmons called for order, and everyone waited. What did you think was going to happen the moment you heard Marcus's story? Did you think the system would protect him? Tell me in the comments right now. And if this story has restored even 1% of your faith in justice today, subscribe to this channel. This is exactly what we are here for. Judge Carolyn Ray Simmons looked at her notes for a long moment. When she raised her head, she looked first at Marcus Webb, then at Derek Calloway, and then she spoke. I am ordering you to pay a fine of $250,000, directed in full to the Oklahoma Insulin Accessibility Fund, a state program providing emergency insulin coverage to uninsured and underinsured patients across the state. This amount reflects not only the harm in this case, but the pattern of behavior that contributed to real danger for real people. That money will buy insulin. It will keep people alive. That is what it will do. I am also ordering the suspension of your pharmaceutical sales license in the state of Oklahoma for a period of 5 years, with a mandatory ethics review required for any future reinstatement in any state. The people who walk into offices like the one on South Denver Avenue deserve to be protected from the kind of thinking you demonstrated, and this suspension is that protection made real. And there is one more thing. You are ordered to complete 240 hours of community service performed exclusively at low-income healthcare clinics and Medicaid enrollment assistance offices across Tulsa County. You will sit across from the people you spent your career viewing as soft resistance. You will see their faces. You will learn their names. At completion, you are required to submit a written statement of no fewer than 2,000 words, reviewed by this court's officer, reflecting on what you learned. That statement will be made part of the public record. She was not done. You are further ordered to provide full coverage of Marcus Allen Webb's insulin and diabetes management supplies for a period of 3 years, paid directly to his pharmacy of choice through a court-managed escrow account. This is not a symbolic gesture. This is medicine. This is his life, and you will pay for it. Then Judge Simmons looked directly at Derek Calloway and spoke not to the room but to him alone. Mr. Calloway, you are 31 years old. You have your health. You have your education. You had every advantage. And with every one of those advantages, you chose to look at a man who had worked 18 straight years, who had managed a life-threatening illness with extraordinary discipline, and you chose to mock him in front of strangers, in a room full of people who were already struggling. You did not do it because you were having a bad day. You did it because somewhere along the way you came to believe that your success reflected your worth and that his hardship reflected his. That is a lie, and this court is here to say so loudly and clearly. Mr. Webb did not plan poorly. He did not fail to budget. He was betrayed by a system he faithfully paid into, and by people who saw profit where they should have seen a person. You were one of those people. In this courtroom, on this day, you are accountable. And this sentence will stand as a reminder that accountability is not optional just because it is inconvenient. She paused. The room held its breath. I hope your family watches what happens here today. Privilege is not something to be protected. It is something to be responsible with. You were given much. You gave nothing back. This court is now requiring you to start. Roland Fitch filed an appeal within 30 days, arguing the patient dignity statute had been overly broadly applied and that the pricing emails should not have been admitted alongside the video. The Oklahoma Court of Civil Appeals reviewed the case for 8 weeks and upheld every element of Judge Simmons' ruling. Fitch filed a second appeal. It was denied at the initial review stage. The reviewing judge wrote in her decision, "The lower court's findings are well supported, clearly reasoned, and consistent with both statute and precedent. There is no basis for reversal." Derek Calloway paid the fine. The escrow account for Marcus's insulin was funded within 60 days. There is a part of this story I think about when I sit down to write. It is not the verdict or the sentencing. It is the moment Marcus sat in his truck in that parking lot after Derek mocked him, alone, engine off, just sitting. That moment happens to people every single day, in parking lots and pharmacies and waiting rooms across this country. Most of the time, nobody is recording, nobody fights back, nobody fixes it. What made Marcus's story different was Sandra, and what made Sandra's action matter was that a judge and a system, imperfect as they are, actually responded. Subscribe to this channel and come with me. Every story we tell is an act of witness. Derek Calloway reported to his first community service day at a Medicaid enrollment clinic in North Tulsa on a Tuesday morning in June. He arrived in khakis and a polo shirt. He sat beside a caseworker named Florence, who had worked there for 11 years. According to Florence, who later spoke to a journalist writing a follow-up piece, Derek said almost nothing for the first 3 weeks. He processed paperwork. He answered phones. He watched people come in one after another, filling out forms for insulin, for blood pressure medication, for inhalers. He watched them do the math. He watched them leave with less than they needed. Around week 7, something shifted. Derek started staying past his required hours. He helped a 60-year-old woman named Darlene navigate a coverage appeal that had been dragging for 4 months. When Darlene's appeal was approved and she cried in the waiting room, Derek did not look away. He handed her a box of tissues and sat with her while she composed herself. Florence said, "I do not know what changed in him, but something did." Derek's written statement was submitted on time, 2,412 words. In it, he wrote about growing up in a world where health care was something that happened to other people's problems. He wrote about a man he met at the clinic, a 58-year-old former iron worker named Paul, who had been rationing his blood pressure medication for 2 years because he was $60 short every month. Derek wrote, "I used to see people like Paul as a market outcome. I do not know how to explain that now except to say, I was wrong in a way I did not know I was capable of being wrong. I am not asking for forgiveness. I am asking to be held to a different standard, one I am trying to earn." Marcus Webb received his first insulin delivery through the court-managed escrow account on a Tuesday in March. Priya drove him to pick up the prescription. A neighbor who saw him come home that afternoon said he was carrying the pharmacy bag, and he looked, she said, like a man who had just put something heavy down. "I think about this case often. I think about it when people say the system never works for ordinary people. I think about the 45 seconds it took Derek to say something cruel and the 18 months it took for that cruelty to be fully addressed. I think about all the Marcus Webbs in all the parking lots who never had a Sandra with a phone, or a journalist, or a judge like Carolyn Ray Simmons. This case did not fix the insulin pricing system. It did not erase years of harm, but it said something out loud. It said that a human being sitting in a plastic chair trying to stay alive is not a market outcome. That matters. It will keep mattering long after this script is over. To anyone watching this who is managing a chronic illness, who is rationing medication, who has ever sat in a waiting room and felt invisible or small, I want you to know something. You are not a burden. You are not a failure. You are not the problem. The strength it takes to manage what you manage every single day, to keep showing up, to keep doing the math, to keep going, that strength is extraordinary. You matter. Your life matters. Your dignity matters. Do not let anyone convince you otherwise. And to anyone watching this who has the kind of privilege Derek Calloway had, who has never had to choose between food and medicine, who works in an industry that touches people's lives at their most vulnerable, I'm asking you something. Look at the people across the counter from you. Really look at them. Remember that behind every case number, every market segment, every coverage gap, there is a person who polishes their shoes on Sunday night and tries their best every single day. Use what you have to help, or at minimum, do no harm. Thank you for watching this entire story. Thank you for staying until the end. Thank you for caring about Marcus Allen Webb, a man you had never heard of before today. A man who just wanted to stay alive and was met with mockery instead of help, and who fought back with quiet dignity until the system finally caught up to what he deserved. This channel exists because of you. Subscribe right now and join our family. We are here every week with stories that remind you that justice can be real, that ordinary people can win, and that one moment of courage can change everything. We are building a community that believes human dignity is not negotiable, that believes no one should be mocked for being sick, that believes the purpose of any system is to serve the people inside it. Subscribe now, hit the bell, leave a comment, share this with someone who needs to hear it today. Join us, stand with us, fight with us for justice, for compassion, for every Marcus Webb sitting in a parking lot right now, holding their paperwork, doing the math, hoping someone sees them. We see them. And together, we make sure the world does too. Subscribe and let us build the world we want to live in, starting right now.